At long last, Texas health officials have announced the end of a measles outbreak that infected over 700 people and claimed 2 young lives. But here's where it gets controversial. The outbreak brought to light deep-seated debates about vaccination, community immunity, and public health priorities. Did this crisis change any minds, or will skepticism persist? Let's dive in. On Monday, the Texas Department of State Health Services, DSHS, officially declared the measles outbreak contained after confirming 762 cases since January. The majority of those affected were children, many of whom had not been vaccinated or whose vaccination status was unclear. Tragically, 2 unvaccinated school-age children from the outbreak area lost their lives, marking the first measles-related deaths in the United States in over a decade. The Texas Department of State Health Services is reporting the conclusion of this year's measles outbreak centered in West Texas. The agency stated, "It has been more than 42 days since a new case was reported in any of the counties previously identified as hotspots for transmission. This milestone marks the official end of the outbreak, but the lessons learned are far from over." The origins of the outbreak were traced back to a Mennonite community in the South Plains region of Texas, where vaccination rates are notably lower than the state average. In Gaines County, one of the epicenters of the early spread, nearly half of all students reportedly held exemptions from mandatory vaccines. Low vaccination coverage created a perfect storm for the highly contagious virus to take hold and spread rapidly within communities. Despite the challenges, public health professionals worked tirelessly to bring the outbreak under control. Jennifer Shuford, commissioner of the DSHS, praised their efforts. "This achievement would not have been possible without a coordinated response that included widespread testing, vaccination drives, disease monitoring, and public education campaigns about measles prevention. These measures were instrumental in curbing what could have become an even larger crisis. Measles is a formidable adversary. It's one of the most infectious airborne diseases known to humanity. A single infected person can potentially transmit the virus to up to 90% of the unprotected individuals they encounter. While there's no specific antiviral treatment for measles, getting both doses of the MMR, measles, mumps, and rubella vaccine offers 97% protection against the disease. That's why vaccination remains the cornerstone of preventing outbreaks like this one." Interestingly, this outbreak served as an unexpected litmus test for Health and Human Services Secretary Robert F. Kennedy Jr., a vocal critic of the MMR vaccine. Despite his past criticisms, Kennedy publicly acknowledged the importance of measles vaccines during the crisis. In an op-ed, he emphasized that vaccines do more than safeguard individual children. They also bolster community immunity, protecting those who cannot be vaccinated due to medical reasons. And this is the part most people miss. While vaccines are undeniably effective at preventing illness, achieving high vaccination rates is equally critical for shielding vulnerable populations. When enough people are immunized, the chain of transmission breaks, making it harder for diseases to spread, a concept often referred to as herd immunity. But the question remains, will this outbreak serve as a wake-up call, or will resistance to vaccines continue to grow? Are we doing enough to address vaccine hesitancy and misinformation in our communities? We'd love to hear your thoughts. Do you think stricter policies are needed, or should personal choice remain paramount? Share your views in the comments below.